Continuing our coverage of the COVID-19 vaccination plan, again, Phase 1B begins today, which means more people in our area can get vaccinations. But to answer some of our questions about this next phase is Winnebago County Public Health Administrator Dr. Sandra Martell. Dr. Martell, let's get right to it. We know who's in Phase 1B. It's frontline essential workers. But how are these groups being prioritized? For example, do teachers go before grocery workers? Do people 65 and older get to go before teachers?
So when we look at this and when we talk about in a region and what we've got available, we are looking at how do we prioritize those that have a front-facing interaction with the public. So we are definitely working on the schools to vaccinate the teachers and the staff, the bus drivers, because we know they are front-facing with children every day as we move more and more children to in-person. Whereas individuals, not to say that they aren't exceptionally important, but again, we understand that there's a pent-up demand to get out of the house. But again, if you're not generally interfacing with the public, then we would prioritize you less. That does not mean that you won't be vaccinated. It just means from timeline, with limited resources available to vaccinate from both a vaccine perspective as well as vaccinator status, we're going to prioritize those who have an interaction with the public that is required as part of their daily operations and jobs.
And Governor Pritzker said we were getting 120,000 doses of the vaccine outside of Cook County across Illinois for this week. How many vaccines do we have right now in Winnebago County?
Well, our estimated shipment for this week is around 5,000 doses.
So 5,000 people in Phase 1B and Phase 1A will get vaccinated likely this week?
Correct. We are working when we say that we're, first of all, I think the other part that people need to understand is we almost kind of have to think about this. We are finishing up second dose of Phase 1A individuals that were vaccinated with the Pfizer product 21 days ago, so 3 weeks ago. So teams to this week are really focused on completing that second dose. We then will begin as kind of concurrently starting with using our other vaccine product, Moderna, to begin, I'm going to say, catching up the Phase 1A that were not part of the healthcare system within the hospital walls. Those are the outside providers. Things like veterinary medicine are now part of Phase 1B. We're looking at dentists. We're looking at eye doctors, ophthalmologists, chiropractors, social workers, all of those individuals that were not able to get as part of the in-hospital. We are also then vaccinating first dosing of Phase 1A while concurrently bringing in some of our Phase 1B individuals that are eligible as well for vaccination. And I also want to remind people, we are also out there working in the congregate care facilities that were not eligible for vaccination through the CMS partnership. So things like milestones and stepping stones, we've also been vaccinating them. So while we vaccinate with first dose, think about this, in 3 to 4 weeks, we have to go back and repeat the same project. And so again, looking at what we've got available in terms of staffing and in terms of dosing of the vaccine that comes in, we are in this game of doing both first and second dose and then kind of moving and positioning to get to the second dose next week for those who would have been vaccinated 3 or 4 weeks ago, and then starting our new phases as we go through that.
For those who are in Phase 1B, what do they do if they register to take the vaccine, but they have not heard anything yet about making an appointment?
Well, first of all, I think we've tried to really encourage, be patient. I think the governor said it. I think Dr. Fauci has said it as well. We know people are excited. We know this has been very promising. People want this pandemic to be over with, but it is going to take a while for us to get vaccination out. So we have to organize systems and schedules. If you've not received an appointment, it does not mean that you won't be receiving one. It's that in terms of pulling through the priority, obviously we're going to go back first and get those Phase 1A individuals that were eligible. So the healthcare workers staff, the frontline groups that now are part of that, and then moving that through would be first, and then looking at in terms of prioritization within Phase 1B. When I talk about that, these are appointment only clinics, so please don't show up. I know people think that they can show up and create, get vaccine. None of our clinics are walk-in, and it's very precise because first of all, we have to make sure we have the right amount of product available, that you're in the right phase, and that we have enough dose to be able then to give you this subsequent dosing. We know you're excited. We're excited for you, and we're excited to be doing this, but we need your patience at this point.
All right, Dr. Martell, thank you for your time. Be sure to head to our COVID-19 vaccine information page on WREX.com, where you will find important articles on the vaccine distribution here locally and a link to sign up for a vaccine through the county website.